Hi, I'm Dr. John Young, Medical Director here at Foundational Health Clinic in Largo, Florida. Today we're going to be talking about protein. The real reason why I started this practice was for two diseases: diabetes, type 2 diabetes, and hypertension. And what I started doing was going back to basic science, and here's what basic science says is this. Type 2 diabetes is really a protein problem. Fasting insulin levels go high. When fasting insulin levels go high, it means your protein intake is low, and you will eventually develop type 2 diabetes. In hypertension, if you don't have enough protein, you can't make nitric oxide. Nitric oxide causes blood vessels to expand. You expand a blood vessel, you drop the pressure. So, in looking at these two diseases, an insurance company came to me and said, you know what, John, we notice that with diabetes, you have a 70% compliance rate with what you do with your diabetics and your ability to get them off the medications. We have a 13 to 15% success rate or compliance rate. And here's why. First of all, people, when you give them diabetic medicines, you think, oh, they're going to feel just fine. That is not always true. A lot of these patients have told me, John, I've been given these drugs, but it makes me feel so bad, I don't even take them. So, what I do to get people off their medicines when it comes to diabetes is, number one, you have to use a protein concentrate. It cannot be a protein isolate. Number two, you have to make sure there's no maltodextrin in the protein, because maltodextrin raises insulin levels and you can't reverse the diabetes. And number three, you need to make sure that there's no oils in the protein. And a lot of these patients are using protein powders. The Europeans found a way to take an oil, powderize it, but when you do that, you hydrogenate the oils and you cause more problems. Three key things that you must remember if you're going to reduce the incidence of diabetes, get them off their meds, or get them completely over their disease, and with hypertension, actually build enough nitric oxide to actually get them off their medications. Simple but easy. And we're going to show you how, in just a minute, how to make a protein shake.